I'm Dr. Ken Landau. Thanks for watching. Let's talk about Flomax, or Tamsulosin. This is a drug for treatment of symptoms related to benign enlargement of the prostate, difficulty urinating if you happen to be a man, and it was approved by the Food and Drug Administration in 1997. So basically all of the drugs in the family now are generic, and they're all extended release, so you only have to take one a day. It was originally developed by a company in Japan, Yamanouchi Pharmaceuticals, and they sold it to Astellas. But right now, since it's generic, lots of drug manufacturers make the drug. So the drug itself is for relief of symptoms of benign enlargement of the prostate. Benign enlargement of the prostate is going to occur in about half of all men by age 50 and 90% of all men by age 90. Symptoms tend to be mild to moderate, but half of the men are going to take medicines in order to gain some relief. In 2008, Flomax was one of the top 20 medicines prescribed, brought in over $1 billion a year. It was made very popular by catchy advertising, not because the drug worked any better than any other drug in the same family. Symptoms associated with benign enlargement of the prostate have to do with irritation or storage problems. Those would be nocturia, getting up at night to urinate, urgency or frequency. And then another series related to bladder emptying or to the obstruction. That's hesitancy, incomplete emptying of the bladder. Maybe the stream starts and stops. Maybe it's a weak stream or you dribble. Maybe you have to strain to urinate. Well, the American Urology Association came up with a symptom score, a checklist, so that when you're in the doctor's office, you just fill out a very simple page form, and it asks questions about the symptoms that I just mentioned. And then if you have a score of 1 to 7, you've got no symptoms or mild symptoms, moderate symptoms if your score is between 8 and 19. And if it's more than 20, you have severe symptoms. Now, it's important to realize that we can get the same thing just by asking you some simple questions. Can you empty your bladder completely? Do you have to go again within 2 hours? Will you stop and start your stream? Do you have difficulty postponing the stream? How about the strength of the stream? Those sort of questions. Well, it's important to realize that the symptoms can get worse or better very quickly. They seem to vary depending on the weather, worse in the cold weather, or if there's stress, physical or mental stress, if you happen to be taking a decongestant, an antihistamine, or even a nose spray. And there isn't all that much correlation with the size of the prostate and the symptoms that you have. Yes, indeed, as the prostate enlarges, the symptoms tend to get worse. But there are two components to the prostate. There's one, the prostate gland themselves, and the other is smooth muscle. Well, the medicine doesn't have anything to do with the prostate glands, but it does have an awful lot to do with the muscles. And just like any other kind of muscle, it can relax or it can contract. Well, when we talk about obstruction due to the prostate, we talk about static obstruction. That's due to the glandular cells. And then we talk about the dynamic component, the component that can change. And we know that the muscles are controlled by those alpha adrenergic nerves from the sympathetic nervous system, and they tend to be clustered in the prostate, in the prostatic urethra, and in the bladder neck. Well, it seems that if you take these kind of drugs, Flomax in particular, of course, that it relaxes the muscle, and as it relaxes the muscle, it allows less obstruction to the stream and causes a decreased symptom. Now, fortunately, most of the fibers of the nerve happen to be in the bladder itself or in the prostate, but some of them are elsewhere, and it's the elsewhere that causes some kind of problems for some gentlemen. Well, it's important to realize that when you take this kind of a drug, you have to start at a relatively low dose. So you start at 0.4 milligrams a day. That's one pill a day. And you take it about half hour after some meal, same meal each day, oftentimes after breakfast. So you take it, And then you keep doing that for about 2, 3, 4 weeks and see if you're okay. If you're okay, then that's fine. If not, then you can increase after the 2, 3, or 4 weeks to 0.8 milligrams a day. That's the highest dose that you would want to take. Now, if you happen to stop taking the drug for any reason, you forget it, you go out of town, and you forget to bring your pills along, then you have to start at the 0.4 milligrams again. Well, how well does it work? Let's say we have a gentleman whose score on that symptom score from the American Urology Association happens to be 20. So right at the dividing line between moderate to severe symptoms. If you take the drug, you're going to drop it by about 5 to 10 points. If you take a placebo, you'll drop the score by only about 4 to 6 points. Now, it's important to realize that when you take the Flomax, the benefits begin within the first week. So it's a very rapidly acting medicine. It's not one of these things that you have to take for a month or 2 months to see if it's going to be effective. So we have a significant improvement. Do the symptoms go away completely? No, they don't do that, but they improve quite dramatically. And in the process, the amount of urine that comes out per second seems to increase by about 10%, so that's pretty good. The drug stays in your body for most of the day, so that's okay, so you only have to take 1 pill a day. It's extensively metabolized in the liver, so if you have liver problems, this isn't for you. 75% goes out in the urine. So again, if you have kidney disease of moderate to severe intensity, this drug isn't for you. Now, there's another problem. And the problem is, remember I said about 70% of all the receptors happen to be in the prostate or in the bladder? Well, some of them aren't just there. Some of them are in the brain. And it might have an effect on cognition or cognitive function. Certainly we know that's true in the mice and in other animal models. And there's a question about what happens in people who have dementia who take this kind of a drug. Well, it seems that if a person continues to take this drug, it continues to be effective, and it can reduce your symptoms by about 30, 35, 40% within the first week, and it maintains that for the whole year, so it doesn't get weaker as time goes on. Now, some of the men who take this drug really have symptoms from other causes, so we have to make sure that you're not suffering from prostatitis or prostate cancer, diabetes or heart disease or sexual dysfunction, or maybe you have a bladder irritant that you're taking. Could be caffeine, could be a stone in your bladder. Oh, those things should be ruled out. And then, of course, there are certain medicines that you might be taking. You might be taking some of the medicines for runny nose or an antidepressant that can make the situation worse. So you should avoid the antihistamines, you avoid the Benadryl. If you're obese, you try to reduce some weight. You don't drink before you go to bed. You limit your alcohol. You limit your caffeine. When you empty your bladder, you wait a couple minutes and try to empty it again, because we know that a normal person can have up to 100 cc's, or about 3 ounces, left in the bladder even after you've completely emptied it or thought you completely emptied it. And you gradually increase the amount of time between your urinations to sort of train your bladder. All of those good ideas. When you take Flomax, Tamsulosin, you could have some side effects. Side effects are relatively common: headache, get some dizziness or runny nose. Maybe you just feel blah. Some people get some diarrhea or some chest pain or some insomnia. But what's scary to some men is they get some ejaculatory failure. You can have retrograde ejaculation, so it goes into the bladder instead of outside. Some men find that's quite problematic. It's due to the relaxation of one of the sphincters that normally closes down during ejaculation, but because of the medicine, because of the way the medicine works, it doesn't do what it's supposed to do, and then ejaculation is what we call retrograde. The major problem with this drug is that when you stand up, about 15-20% of the men are going to get a little lightheaded. the blood pressure is going to go down by more than 20 millimeters. The heart rate is going to go up by about 20 beats a minute. And some men are going to feel faint or lightheaded or dizzy, feel that you're spinning around the room's spinning about you, vertigo. And actually could even get worse if you take Viagra. It's suggested that before you take this kind of a drug, that you should be checked for prostate cancer. And it's also suggested that if you're taking certain other kind of medicines that might interfere with particular enzymes that degrade the Flomax, if you're taking terbinafine, if you're taking erythromycin, if you're taking clarithromycin, you got to be real careful about taking this drug because it won't decrease, it won't be metabolized normally. Now, there's certain warnings and precautions, of course. You have to be careful if you're taking it with warfarin. You have to be aware of the possibility of priapism, prolonged erection for more than 4 hours. You shouldn't take it with any other kind of alpha blocker. And if you happen to have a cataract and you're going to have surgery, it can cause what we call the floppy iris syndrome. So you have to tell your ophthalmologist, if he or she doesn't ask, that you're taking this drug, because otherwise it can cause some problems during cataract surgery. And again, if you have advanced disease of your kidneys or your liver, this drug probably isn't for you. You got to be careful if you're taking it with a medicine like Tagamet. And then the Food and Drug Administration issued a safety warning for different kind of medicine, Proscar and Avodart, and it issued a warning for high-grade prostate cancer. Now, there's argument whether that's true or not, but Tamsulosin comes in combination in a certain kind of pill called Jalin with Avodart. So for people who are concerned about cancer of the prostate, this might be something of concern. Now, potentially more worrisome, in January of 2018, Pharmacoepidemiology and Drug Safety from the University of Connecticut, looking at about 500,000 men on Medicare, followed for about 20 months, compared men taking Tamsulosin to men on either no therapy or men taking other drugs in the family, and they found that there was a 17% increase in the number of diagnoses of dementia, of Alzheimer's type dementia, and that at a higher dose, that rose to about 40%. And it happened most in men between the ages of 65 and 74. So the question is that really legitimate? That's not necessarily cause and effect. That's men who were taking it, had those kind of symptoms, had the dementia, and we don't know if it's related or not. But we do know that it's statistically potentially important. And another thing, at least in the animal studies, the animals who were given this drug had a higher incidence of fibroadenomas of the breast and adenocarcinomas. Now, how does that play out in humans? Again, we don't know. And part of the reason we don't know is that over 3/4 of the drug studies that involve Tamsulosin have not been published. If you overdose on the medicine, what's going to happen? Blood pressure is going to fall down a whole lot. What other conditions has it been used for off-label? Interestingly, if you happen to have a very small kidney stone, a kidney stone that measures between maybe, say, about 4 millimeters and 10 millimeters, so certainly less than half an inch, a 1/4 inch, say, well, it relaxes the tube, relaxes the ureter, and maybe allows some of the passage of the stone, if it happens to be small. And also, if you happen to be catheterized, and you've had the catheter in for a while, well, if you take the drug, it might reduce the likelihood of needing recatheterization or having another obstruction. Are there other drugs in the family? Sure. There's Uraxatrol and Cardura, there's Rapaflo, there's Hytrin. And then you can have a medicine that actually will work on the size of the prostate gland itself. Those are the medicines, finasteride, you know it as Proscar, or Avodart, dutasteride. Well, Consumer Report looked at the medicines that were available and said, at that time, this goes back to 2009, Cardura seemed to be the best bang for the buck. Now that most of the drugs are available as generics, it doesn't really make all that much difference. How much does the drug cost? Well, that all depends. The answer is too much. The drug costs, if you go buy the drug at the drugstore with cash, the generic is going to cost between $90 and $100 at most places. But for whatever reason, at Smith's Pharmacy, it's only $24. With a coupon, at most pharmacies, it's between $10 and $30. You could buy the brand name, the Flomax itself, for $240 cash. And remember, we have two different strengths. The strengths, the 0.4, the 0.8, and interestingly, the company, Flomax, they price it. So if you need the higher dose, you're going to have to take two, and that means double the price. So anyway, now you know about part of the treatment for benign enlargement of the prostate with Flomax or Tamsulosin. Thanks for watching. I'm Dr. Ken Landa.